Dear learners, as part of the Swayam MOOC course on Geography of Health and Well-being, today we will discuss the topic disasters and human health. With the help of this module, you will be able to understand the concept of disasters, hazards, and how they are linked to human health. You will be able to reflect upon the steps involved in disaster management and will be able to familiarize with the strategies of disaster management to improve health in an emergency situation. The outline of today's presentation is understanding the definition of disaster, hazard and vulnerability, types of disasters, impacts of disasters, disaster management, disasters and effect on human health, and disease control after disasters. Disasters can be slow like droughts or sudden like earthquakes and volcanoes, predictable such as cyclones, or unpredictable such as earthquakes and cloud bursts. They can be natural or human induced events that lead to losses. This loss is the loss of life, loss of property, biodiversity, and its spiraling effects are beyond one's comprehension and control. So much so that it is beyond the capacity of the state to recover and therefore requires external support. While disasters actually take place, hazards are merely potential disasters. For instance, if an earthquake takes place on an island that is not inhabited, the earthquake is merely a hazard that may be transformed into a disaster if and only if there is loss of life or property, or if it disrupts the economy or ecology to the extent beyond repair. Therefore, it is the probability of occurrence of a potentially damaging phenomena. Vulnerability is the extent to which community, structure, service or geographic area is likely to be damaged or disrupted by the impact of particular disaster. Vulnerability can be of following types. 1. Physical vulnerability. It depends upon physical location of people and elements at risk. This depends upon capacity of buildings, the materials and technique used to create infrastructure. For example, Japan is highly prone to earthquake disaster, especially of high and medium intensities. But people seldom die or are injured as the infrastructure created is with the material and techniques that can withstand the impact of these earthquakes. Economic vulnerability. This is related to the income level of people. Poor people are considered to be more vulnerable as their houses are built of weak material and are located in dangerous areas such as mountain slopes, river beds, etc. Also, they do not have insurance or safety nets like affluent populations. Social vulnerability. Some sections of the population are more vulnerable than others, like women, children, elderly, physically and mentally challenged, and those dependent on critical facilities. Now, let's discuss the types of disasters. As you can see in the diagram, there are two broad categories in which we can classify disasters based on origin. 1. Physical, geophysical or natural disasters, or human, technological and anthropogenic disasters. Further, the former category can be divided into 4, that is meteorological like thunderstorms, dust storms, heat and cold wave, geological such as earthquake, volcanoes, subsidence, tsunami. Hydrological, related to excess of water, that is floods, or dearth of water, that is droughts. And biological, that includes epidemics and pest infestations. On the other hand, human technological or anthropogenic disasters may be related to industries such as the Bhopal gas leak, infrastructure such as derailing, oil spill, nuclear blast, or others like terrorism, riots and war, particularly and fire, particularly urban fire. It is interesting to note that the kinds of disasters have increased over the last few decades. While the Imperial Census of India identified 9 disasters, 31 disasters were listed by high-powered committee between 1941 and 2002 that included dam burst, mine fire, nuclear war, oil spill, hailstorm, pest attack and many other added in the list. Further, 35 kinds of disasters may be noted for future, including biological war, chemical war, genetic engineering war and climate change. This increasing diversity of disasters is quite alarming, as not only the kinds of disasters are increasing, but their frequency and intensity is also increasing. That means the number of times any disaster would take place in a location has increased and intensity also amplified. Now, let us gauge the impacts of disasters. This figure, you can see the numbers represent a sharp increase in the number of recorded disaster events by comparison with the previous 20 years. Between 1980 and 1999, 4,212 disasters were recorded that are linked to natural hazards worldwide, which claimed approximately 1.1 million lives and affected over 3 billion people. But between 2000 and 2019, there were 1.23 million deaths and 4 billion people were affected by over 7,000 disasters. In this figure, one can easily see, and it is clear evidence, that with increase in the global average temperature by about 1.1 degrees Celsius, the impacts are felt in increased frequency of extreme events including heat waves, droughts, floods, winter storms, hurricanes and wildfires. In the following figure, one can observe that Asia suffered the highest number of disaster events. In total, between 2000 and 2019, there were 3,068 disaster events in Asia, followed by 1,756 events in America, 1,192 events in Africa. The high frequency and impact of disasters in Asia is largely due to the size of the continent and landscape that represents a high risk of natural hazards such as river basins, floodplains, seismic fault lines. Additionally, we also have very high densities of population living in disaster prone areas of the continent. In terms of affected countries globally, China and United States of America reported the highest number of disasters, followed by India, Philippines and Indonesia. In the following figure, we can see that between 2000 and 2019, over 4 billion people worldwide were affected by disasters and over 1.2 million lost their lives. Overall, in the past 2 decades, the average number of people affected worldwide by disasters is approximately 200 million per year. Floods have accounted for 44% of all disaster events, affecting 1.6 billion people worldwide, and highest figure for any disaster type. while earthquakes and tsunamis are the deadliest form of disasters, accounting for 58% of total deaths. It can be seen that there are notable differences in disaster impacts across income group of countries. The high income countries tend to have lower number of affected and killed people by disaster event, but they significantly suffer in terms of economic losses, while low income countries report limited economic losses and relatively high death toll per disaster event. Lower middle and upper middle income countries make up the most of disaster events, deaths and total people affected. However, they also account for most of the world's population. High income countries accounted for most total economic losses, that is 67%, with a total of 1.9 trillion US dollars between 2000 and 2019. In comparison, low income countries accounted for 23% of total disaster deaths, accounting for less than 10% of the world's population. In fact, low income countries had highest average number of deaths per disaster event, followed by low middle income countries. It is to be noted that we have only learned the impacts from major natural disasters, and with this you can understand the impact of all possible disasters taking place over and over again. We have tried to manage disasters, but one must ask the question, can we truly manage disaster, or is it that disasters have taken place on the planet Earth even before it was created, in that whole process of creation, and will take place in the future? The only role we have is to reduce the risk, to reduce the impact and intensity of the disasters. We are not equipped to fully manage disasters unless they are of human origin. Disaster management is the process of effectively preparing for and responding to disasters. It involves strategically organizing resources, lessening the harm of disaster cause. It also involves systematic approach to managing the responsibilities of prevention, preparedness, response and recovery. In the following diagram, you can see the disaster management cycle, where the pre-disaster event, one may focus on mitigation and prevention efforts and the aim to reduce potential damage and suffering which disaster can cause. While we cannot prevent disasters, we can certainly prevent them from becoming compounded because of neglected causal factors and manageable risks. Mitigation specifically refers to actions taken that can lessen the severity of the impact, and preparedness deals with well coordinated responses to disasters that requires prior planning, such as mock drill, learning about do's and don'ts of a disaster, identifying organizational resources, emergency numbers, organizing events that improve disaster readiness, such as emergency shelter site, evacuation routes, emergency energy and water resources. After the disaster has occurred, response and recovery become priority. During and immediately after the disaster is the emergency situation. One may focus on delivering help and interventions that can save lives, safeguard health and protect buildings, animals and community property. Following this initial response, efforts shift towards supporting communities to rebuild themselves emotionally, economically and physically. And lastly, all developmental strategies should keep in mind the takeaways, the learnings, and plan for future more efficiently and intelligently, so that another disaster of such intensity can be better managed. This is the traditional model of disaster management cycle. Here the length or relative importance of component parts, for instance the actual recovery period, may vary considerably in different disasters, is not there. And therefore, the alternative model presented here is an improved version of the earlier one that underlines the fact that disaster and managing it is a continuum of interlinked activities. It is not a series of events which start and stop with each disaster occurrence. This version includes new terminologies in the stages of disaster management cycle. For instance, under preparedness, we now include warning and threat. And within response and recovery, there is emergency phase, followed by restoration and reconstruction with constant review of success and failure. That means it has strong feedback mechanism. The segments in the alternative model should not be interpreted as separate from each other. Rather, it is important to understand that segments are generally overlapping or merging with each other. For instance, some response activities may be initiated prior to the disaster impact, that is during the preparedness, and these activities might include precautionary movement of threatened persons or communities to safe havens prior to the impact, say for example a cyclone. Similarly, recovery action often begins while the emergency response period is still operative. For example, a technical advisory team would probably begin collecting information immediately after impact, and such information would be used for both response and recovery purposes. The important issue here is that the ways disaster can be managed and its impact mitigated at each stage of disaster management cycle, so that the adverse effects on human health can be minimized. It is imperative to prevent the risk. This can be done at three levels: primary, secondary and tertiary. The primary level advocated health promotion and protection before the onset of the disease. This is dependent upon interplay between host, agent and environment. The secondary level deals with early diagnosis of disease and the tertiary with rehabilitation. The strategies included in prevention of risk are immunization, hygiene and sanitation, vector control, media campaigns through both print and electronic media, mitigation plans and participation of community, and training and exercise involving local people and NGOs. Disaster management requires deliberate planning for estimating the requirement of water depending upon the climate and habits of people. For as an example, in hot climate, an average person requires 145 liters of water every day, but 6 liters of water per day per person water is required at evacuation stage, and approximately 8 liters per day per person may be needed in relief camps. So, it is important to identify the water resources available, methods of purification, accessibility and distribution route, etc., before the disaster has even happened. During and immediately after disaster, the pre-hospital preparedness is highly critical. It addresses the rescue and relief operations, providing first aid, triaging and transporting the injured to the hospitals. In this phase, organization, command and control centers play a pivotal role. Immediately after the warning, the command is under disaster coordination cell and emergency control points are set up. From here, the medical teams disperse to disaster site. There, the first task is prioritization. The injured are classified into 4 groups. First, severely injured casualties who can be saved by stabilization, transported to hospital and provided treatment there. Second, urgent but can be transported after some time. Third, walking wounded. And fourth, dead or very severely injured. The most experienced team member at the disaster site does triaging. Tags based on triaging is placed on the victims that contains their name, age, sex, tagging priority, basic medical findings and initial treatment given. As per the above categories, tags of different color like red, yellow, green and black are placed. Once the victims are taken to the hospital, again triaging is done and appropriate treatment is provided. The details of people lost their lives is crucial and is provided to emergency control rooms from where it can be disseminated through media. This whole system may sound simple, but in moments of panic and chaos, many times the important details are missed or overlooked. To act in these situations where a major disaster has disrupted the lives of hundreds or thousands of people, disaster mock drills and preparedness is vital. Staff alert system, emergency numbers, routes, policies, procedures, emergency department, security arrangement, public information system and coordination among the staff is most critical aspect in disaster management. In the post-disaster impact which takes place from 4 days to 4 weeks post-disaster, airborne, foodborne, waterborne and vector diseases are seen. Examples of diseases in this phase are cholera, bacterial dysentery, cryptosporidiosis, rotavirus, norovirus, salmonella, typhoid, paratyphoid, giardiasis, hepatitis A and E, and leptospirosis. Communicable respiratory infections in post-disaster settings include viral, bacterial, and diseases transmitted via emergency route. Important vector-borne diseases following disasters include malaria, dengue, Japanese encephalitis and yellow fever, all of which are transmitted by mosquitoes. These are spread by standing mosquitoes that breed in standing water. In the rehabilitation stage, the focus shall be to listen to the victims and help them overcome the loss and trauma. The psychological effect of disasters are more drastic among children, women and dependent elderly population. After any sudden disaster or chronic disaster, they become more vulnerable to mental health. The psychological impact on children due to disaster can be in the form of PTSD, that is post-traumatic stress disorder, depression, anxiety, emotional distress and sleep disorders. Emotional instability, stress reactions, anxiety, trauma and other psychological symptoms are observed commonly after disaster and other traumatic experiences. Disease control after disasters. It's very important that accurate risk assessment for communicable diseases after disaster is identified in order to manage and also to understand the epidemics and endemic diseases that are common in the affected area. Similarly, the living conditions of affected population are that are evacuated, that has to be given special attention in terms of availability of safe drinking water and adequate sanitation facilities. Also assessed are the age distribution, nutritional status, immunization coverage of those affected and the degree of access to health care. Prevention and control of disease begins with hand washing and proper handling of food and water, with sewage disposal, oral rehydration therapy to overcome diarrheal diseases. Rapid mass vaccination is instituted and disease surveillance and immediate and appropriate action is the key to control the spread of disease after disaster. With this, we conclude the lecture on disasters and human health. Here is a possible list of books, articles and websites that are useful for understanding more about the topic. Thank you for your patient listening. Hope you had an enriching learning experience. Thank you.